Hi guys, today's lecture about mucoceles. Muco means there is mucus and cele means there is cavity. In Latin you can say muco means mucus and cele mean the cavity. So this is Latin word made by mucus and cavity is called mucoceles. Mucocele is mucus filled cyst. Most common disorder of the minor salivary glands and typically presenting as single, blue or translucent sessile swelling on the lower lip. Most commonly on lower lip, or it may be floor of the mouth, buccal cavity and oral cavity. It is equal in female and male. Age most commonly affected between first to third decade. And rare in infant and although can occur in neonates. Common site and order. Most common location is lateral surface of the lower lip, just lateral to midline. It is the most common location of the mucocele. Then floor of the mouth, then ventral surface of the tongue, and then buccal mucosa. Clinically, if you see, there is single, recurrent, fluctuant, painless, well circumscribed, bluish swelling that ruptures easily to release viscid salty mucus, and they are occasionally multiple, but most of the time they are the single. So MCQ is most common site. It's lateral surface of lower lip. If you talk about type of the cyst, there is two type of mucoceles. One is extravasation type mucocele, or you can say pseudocyst. Second is retention mucocele, or you can say true cyst. Because in extravasation type, their mucus is spilled or leakage surrounding connective tissue, so there is no epithelium. But in retention mucocele, there is obstruction of the duct, which leading to dilatation of minor salivary gland, leading to true cyst formation, that is epithelial and cuboidal epithelium in the cyst. But in this pseudocyst, there is no epithelium, so that's why it is extravasation type or pseudocyst type of mucocele. The duct damage due to any trauma leading to pooling of mucus in adjacent connective tissue, like this picture, and more common in children, and it is mostly symptomless. There is no pain in this extravasation type of mucocele. But in retention mucocele, it is less common, or there is surrounding epithelium is also present. That's why it is true cyst. It is because of partial or complete obstruction of excretory duct, maybe because of silolith, stricture, or any food particle obstruction of minor salivary gland, leading to pooling of the secretions, which occur in common in the middle or late life. If you see this picture, there is obstruction due to that plug or calculi or silolith, so there is pooling of mucus. So there is true cyst because of obstruction of epithelium, obstruction of excretory duct. There may be mild pain due to the obstruction, and it is more common on the floor of the mouth. Best example is ranula. And this, if you see, there is extravasation of mucin in the adjacent connective tissue in the extravasation type of the mucocele. Now talk about treatment. Some may resolve spontaneously if it is small. If it is large, recurrent, requires surgical excision or laser surgery, like this. If it is lower lip, if this is the mucocele, so you have to do laser or cryo or any cautery. So you have to remove with margin, clearly you have to excise it. And less common that proven, maybe less proven efficacy treatment is you can give intralesional corticosteroid or prime rose oil, that is gamma linolenic acid, but this is not going to be very useful. Only you have to do large recurrent mucocele excision. Thank you so much.